Hey, good evening, Pahrump. I'm Dr. Michael Reiner, your solo host tonight. Basically, I think Dr. Christensen is still hung up in the office, and I was able to actually slip out of the office in time to make this show. So we're having a nice live show, and I'm gonna be your solo host tonight. So we'll be talking about medical issues, anything or any other issues you care to bring up. This is the first live show of the new year. I knew there were reruns, and we actually taped a 30-minute segment with the new nurse practitioner, Melanie Lentz, who is in our office. So for those followers out there looking to get in to see somebody quicker, she certainly has openings on her schedule that would allow you to be able to get in to see somebody, and then at least get seen, and then if you needed to follow up with me on a later basis. Anyway, I guess you got the, let's say we got the Wellness Center there, and then we'll put my office up there. Hey, Ray, good morning, good afternoon, I guess.
How about good evening?
How you doing?
Can you hear me all right?
I can.
Okay. Yeah, the Wellness Center, I stopped by, me and Louis stopped by to see what it's all about. It's a nice place you guys got going there.
Yeah.
I highly recommend it. Yep. Everybody's very friendly, and seems like you're doing pretty good. There's enough people coming in, maybe the place will work out good.
It's busy, you know. It's nice to have that facility to be able to get, you know, if you have back pain, and then Dr. Bill Craig is over there, so you know, be able to see a doctor and work in conjunction with the physical therapy and the support. I think it's a great mix.
Yeah, I think so too. Hey, I saw a case in court the other day that really astounded me, because Judge Jasperson had a fellow in front of him who really needed to be released for medical reasons, and instead he kept him for 7 days. And his father, the father of the guy that was arrested, was really upset because he said he has a contagious series of abscesses, and he doesn't. And why Jasperson kept him locked up is beyond me. Just release him. The guy wanted to go see his doctor and get it taken care of. How do you handle something like that? Do you quarantine somebody into jail because it was highly contagious, or do you just prescribe antibiotics and leave it at that?
Well, you know, what I have found with my limited exposure working inside the Nye County, you know, jail system is that there's a lot of people don't take care of themselves outside of the jail system, but when they come in the jail system, you know, now that they're a custodian of the Nye County criminal justice system, you know, they have to provide that care, so they have nothing else to do but to take care of themselves, which again, I have not a problem with. I mean, you might as, I mean, they're basically, the Nye County is responsible for doing that. In your particular situation, nobody knows the assessment of what the actual condition is and what it could be. So that's why we in the jail, if the patient is an inmate, we would assess that situation, decide whether it is truly a medical emergency or a medical condition that requires treatment outside of the jail system. I mean, we've been very effective in reducing almost to very minimal the amount of visits outside of the jail system, because they would have to pull in extra deputies, have to take them to a doctor's office. It was up to the deputies to decide whether or not the condition warranted a medical visit. So by being in the jail, we're actually able to actually see most of the inmates, deal with their issues, and treat them right then and there to make a decision on what's appropriate and what's not appropriate. So it turns out to be a very good situation for Nye County and for the inmates. So I think Jasperson's, I'm not a lawyer, but I think his decision is, if he got convicted of an issue and he has a criminal thing that he needs to be in jail for, put him in jail, he then becomes the custodian. There's no guarantee that if he let him out of jail that he would go to the doctor. He could just be saying that, and you know, people in the criminal justice system do.
Well, in this case, Doc, his father was in the courtroom, and this is very, you know, very rarely does it happen where someone stands up and say, "Look, this is a serious situation," and he approached the judge and said, "Please, let them out. I'll take them to the doctor. It's got to be taken care of. And it wasn't like this guy was some heavy criminal. They were all minor charges against him. But I applaud what you're doing. It's magnificent that you are able to go in there and help these people out, because until you got in there, I saw like no hope. It just seemed like everybody was either suffering or not being tended to. So I applaud what you're doing.
Well, and certainly, you know, Jasperson's hands may be tied. I mean, if he was guilty of something that required some jail time, I mean, his hands could be tied in that situation. But once he places them in the custody of the Nye County Sheriff's Department and he has a condition, he has to fill out a form in his condition. He has to tell everybody what it is, and then it's up to the Nye County to take care of that condition, and that's when they rely on what we're doing there to get him treated. So there is a mechanism in place now to be able to treat those inmates either acutely or non-acutely, and so I don't think he saw it as a reason, a legitimate reason enough not to incarcerate that particular person, because he knew that that situation could be taken care of. Well,
the situation was this fellow was not convicted of anything. He was arrested for minor offenses, and I didn't see it. And I'm just voicing my opinion because I sit in these courts all the time. When I see something that is not appropriate, I point it out. All right, I just got one other question for you, and then I'll open the lines up. I hear the term blood work tossed around quite a bit. What does that mean, and what does it encompass, and what are you guys searching for with blood work? And then I'll open the lines up and let somebody else get in. Thank you very much.
Yeah, well, good, and Happy New Year, Ray. And Happy New Year to everybody out there. This is, again, the first live show. So blood work, it's a broad scope. I mean, we have blood workup. There's lots of different tests that you can order, but in general, I mean, if I said I want you to have a blood workup, I would do what we call a comprehensive metabolic panel, which would include about 20 different tests, and that includes a blood sugar. It's going to look at your electrolytes, sodium, potassium, CO2, those particular things, and then it's going to look at a BUN and creatinine, which are blood urea nitrogen, and a creatinine. Those try to assess your kidney function, but they give you just a brief window, but they're not very sensitive. They're very specific. They're meant to catch big problems, but they don't really tell you much. And then we do liver function tests, looking at the two basic liver enzymes and seeing if you have any of those particular issues going on. So it encompasses quite a few. It looks at bilirubin, looking for any other liver or bile particular problems. So it encompasses quite a bit on that comprehensive panel. In addition to that, then we order usually a complete blood count, which is called the CBC in short term. And complete blood count would look at your white blood cell count, looking for leukemias, low white blood cell counts, which could be indicative of some bone marrow dysfunction or some other illness that could be affecting you, or elevated white blood cell counts or different types of issues, and we can talk about that on different levels. But there's lots of different white blood cells. There's stuff that fight bacterial infections, and there's some that fight viral infections, and those can be changed. And then it's going to look at your hemoglobin and hematocrit, which are your blood components. So hemoglobin is the actual oxygen carrying molecule, and the hematocrit is the amount of red blood cells compacted, which tells you whether or not you are suffering from either low iron or the low ability to make red blood cells. And then we look at the different indices or the different types of red blood cells, whether they're big, small, or weak, and they don't have a lot of oxygen carrying hemoglobin capacity to them. And then we look at the different white blood cell types and see what they are, and so that's a pretty indicative test. And then we usually order a lipid panel, which is a basic cholesterol screening, which is looking for, your total cholesterol, your HDL, your LDL, those types of things. So that's one particular tests, and then we kind of sometimes do what we call a thyroid screening, which we look at thyroid stimulating hormone. And then depending on whether or not you have any predisposition to diabetes, that might throw in an average blood sugar. But those are usually the basic things, and there's a million different tests we can order, but those have to be somewhat history defined. I mean, I got to know what I'm looking for. I just don't order a test just to order a test because I won't know what the results are. I mean, I have to have a clinical suspicion of a problem, and then with that, from that clinical suspicion, I have to use the basis of my my experience to know which test I need to know in order to do that. So is there any value to getting complete blood work? Well, yeah, I mean, you might pick up a lipid problem, you might pick up a blood problem. So those things I think are useful once a year for general screening purposes. They're not that expensive. I think for all that test, you can usually get a cash price for around $130 to $140 if you're paying cash for most of that. And that's really a cheap insurance policy to check for diabetes, to check for any blood disorders, to check for any liver failure, kidney issues, and whether or not you might be at risk of cholesterol-related issues. And we use your family history also with that. So good thing to get done. Now's the time of the year to think about doing that. So good question, and we're going to go to break, and we'll come back and pick up another topic. Thank you for tuning in. Hi, I'm Dr. Michael Reiner, your host of the Independent Doctors of Pahrump, a TV show that airs Monday night on Channel 46. I want to remind you that I am a practicing physician in Pahrump, and I'm an independent practitioner, which means I am not bought by any insurance company or corporate medicine. We provide the highest level of care. We have nurse practitioners. We have other physicians, specialists who come to our office. Please come visit me. I'm at 1316 East Calvada here in the heart of Pahrump. Thank you.